I'm testing my mic. Can anyone hear me?
Yes, we can hear you.
Okay, wonderful, wonderful.
Welcome. Good afternoon.
Good afternoon. And are you Taylor?
Yes, I am.
Oh, hey Taylor, how are you? It was so funny. Someone first denied me access, so I said, let me try to just get back in again.
Welcome. Thank you so much for joining us, and welcome, Dr. Tasnew. Thank you so much for joining us this afternoon.
Thank you for having me.
Absolutely. All right, and one of our co-chairs is here. Good afternoon, Nina.
Hi, good afternoon.
So we will continue to allow folks in the meeting, but just continue to use that chat feature to introduce yourself, and we will go ahead and get started. All right, so good afternoon, everyone. Thank you so much for joining us for our March Behavioral Health Advisory Group meeting. I see a lot of new faces, so that is very nice to see everyone this spring afternoon. Happy spring, by the way. Hope everyone can get outside and get some sunshine today. So thank you so much for taking time out of your day to be with us, and we are looking forward to a wonderful meeting. So to get us started this afternoon, we are going to do some quick welcome and introductions. We are going to hear from Brittany Vasquez about the Children, Youth, and Family SAMHSA grants. We also have an exciting presentation from the Spectrum of Hope, Hope Connections. We will hopefully get to hear from you all who are with us today in a youth mental health questionnaire and allow some time for open discussion. Of course, we will end out our meeting with community announcements in upcoming meetings, and then we will adjourn you all for the afternoon. So to get us started this afternoon, if everyone who is new joining us today, if this is your first meeting, if you would like to introduce yourself with your name, organization, and we like to have this mindful minute question. And because we're talking about youth behavioral health today, our mindful minute question is, if you could give one piece of advice to your younger self about mental health, what would it be?
Well, I can start. Can you guys hear me?
Yes, we can.
Okay, wonderful. Because everyone was so silent, like, who can jump in? I'll
Yeah.
just jump in. Hi, my name is Dr. Yvette Butler-Yabard. I'm the executive director of Gapbuster, and we are new to this group, and I'm excited about hearing more, and really excited about doing more work on the mental health side for our young people in Prince George's. And so, if I would tell my younger self, I would say, don't sweat the small stuff because it's not going to change anything. It's going to be there. Don't sweat it. Let it roll off and keep moving.
Hi, this is Nesreen Hill from Gapbuster as well. I would tell my younger self that it's okay to say no sometimes.
Good afternoon, everyone. My name is Abila Tazanu, and I'm from Spectrum of Hope. I serve as the director and pediatrician, as well as the project director for our Hope Connections family guidance program, for which we received the funding, and I'll share a little bit more about that. If I were to give advice to my younger self, I would say give yourself grace.
Oh, can you all hear me? Oh, okay.
Yes.
So, good afternoon. I'm Rhonda Mitchell. I work with the Prince George's County Health Department, Family Health Services Division, and through a memorandum of understanding, I work with Dr. Abila Tazanu as the Community and Physician Outreach Coordinator, Spectrum of Hope. And I don't know, but I think I would tell my younger self, you are amazing. Just keep doing what you're doing.
Mm-hmm. I can second that.
Hello, this is Brittany. I'm the program assistant for Gapbuster Inc. If I had to give my younger self a message, it will be to always speak up for yourself, even in uncomfortable situations.
Everyone has such good advice. I'm just going to make a BHAG book for us.
Okay. Hello.
Sorry, go ahead, Brittany.
I'm Brittany Vasquez. I'm from the Prince George's County Health Department, Behavioral Health Division. And a piece of advice I would give my younger self about mental health would be that I guess your problems are never too small to want to reach out and talk to someone.
That's a good one.
Hello, this is Ken Alford. I'm the Director of Nursing for the Recovery Centers of America in Waldorf, and also the Chief Clinical Consultant for Brightpoint LLC in Prince George's County. A piece of advice I would give my younger self would be, it's okay to forgive yourself, and it's okay to move on. And you don't have to be an Iron Mountain and strong every day. There's some days that you can ask for help.
Yeah.
Underlining Iron Mountain. Just emphasis. That I think that could be a chapter title. We'll just make that. That's just so good that, you know, you just name your price and I'm gonna make that the chapter title there. So we do have several new folks joining, so I'll do a quick introduction. Hi, everyone. My name is Taylor Palmer, and I'm with the Prince George's County Health Department. I support the Prince George's County Healthcare Action Coalition and specifically helping to facilitate the BHAG. So it is an honor to see you all. And I'm going to pick on our co-chairs, if I could, real quick. Margaret, Nina, and Carlos, if you guys wouldn't mind doing a quick introduction.
Sure. Thank you, Taylor. I just want to welcome everyone, and I love all of the mindful things that you would say to your younger self. My name is Margaret Fowler, and I'm just glad to be here today. And I work with, I'm the Executive Director for Totally Linking Care.
Hi, I'm Nina Ward. I am a program chief with Behavioral Health Division at the Prince George's County Health Department. I'm very excited to be here. Very excited about this question. Mindful Minute, that was a great starter, Taylor. Thank you. And a great chance to reflect, hearing everybody's mindful minutes. I think that's, as Taylor and Margaret have said, are really great advice throughout life, not just, you know, I know we're focused on youth mental health today and behavioral health, but what great snippets of advice to hold on to throughout life.
Yep, and hello everyone, and welcome to the team, all the new members. My name is Carlos Mackel. I'm the project manager for behavioral health and strategy at Totally Lincoln Care in Maryland.
Thank you for that. And everyone, just keep using that chat function. We've got a lot of good advice for the here and now and looking back in the past. So thank you all for your introductions and your participation. So to get us started this afternoon, I'm very excited to introduce Brittany Vasquez. Brittany is a licensed master of social work and a certified forensic social worker. And today she is going to be presenting on two new SAMHSA grants, the Healthy Transitions Grant and the System of Care Grant.
Do you have my, oh, sorry. Hi, everyone. So again, I'm Brittany Vasquez. I'm from the Health Department's Behavioral Health Division, and we were recently awarded two SAMHSA grants in September, so we're very excited. So we were awarded the System of Care Grant, which focuses on children ages birth to 21, as well as their families or caregivers, and the Healthy Transitions Grant, which focuses on youth ages 16 to 25. So the System of Care Grant and the Healthy Transitions Grant were awarded September 30th, 2023. The System of Care Grant is a 4-year grant ending in 2027, and the Healthy Transitions Grant is a 5-year grant ending in 2028. So, what is a system of care? A system of care is a spectrum of effective community-based services and supports for children and youth who have or are at risk for developing a mental health or other challenges, as well as their families and caregivers, the ones that are there supporting them. And it's organized into a coordinated network. It builds meaningful partnerships with families and youth and addresses their cultural and linguistic needs in order to help them to function better at home, in school, in the community, and throughout life. Next slide. So this is just a map of the systems of care throughout the US. You could see that there's a lot of blank space, so we definitely want to keep encouraging system of cares to be implemented throughout the US to support these youth and their families. So system of care is not really a model to be replicated, and it's not a single program, but it's a coordinated network of services across multiple agencies. So all of us working together to make sure that we're providing the youth and their family members with the services that they need. So it's not just a treatment or clinical intervention that directly improves child and family outcomes without accompanying changes at the practice level to provide effective services and supports to achieve positive child and family outcomes. So the system of care model really puts the child and the family in the center of all the services. So nothing is really more important than the other. We just need to make sure that we're getting this family or this child or youth the services that they need. So the system of care is designed to ensure availability of and access to a broad, flexible array of effective, evidence-informed, community-based services and supports for children and their families that addresses their physical, emotional, social, and educational needs, including traditional and non-traditional services, as well as informal and natural supports. So for the System of Care grant, it's a $4 million grant over the course of 4 years, and we intend to serve at least 350 children in those 4 years, children, youth, and their families. And then the Healthy Transitions grant is a 5-year grant with $3,750,000 to be used over the 5 years. And our goal is to serve at least 275 transition-aged youth. There is an overlap between system of care and healthy transitions, that 16 to 21-year-old overlap there that you see in the graph. And that will really support our mission to really bridge that gap between the children, the pediatric, and the adult healthcare system. So all of our partners for the System of Care grant is the University of Maryland. They're our evaluation team, so they'll collect and report on the data. Synergy Family Services and Maryland Family Resource Center are our outpatient mental health clinics. NAMI of Prince George's County provides peer-led support groups, as well as peer support specialists for the families and caregivers of children and youth who are experiencing serious emotional disturbance. And Maryland Coalition of Families has a lead family coordinator to ensure the smooth operation of referral pathways to the entire continuum of existing SOC services. And they also will provide family peer support and advocacy services. And then we also are hopefully going to be hiring a project director who will oversee this whole project and lead it. So our first goal with the System of Care grant is to enact local healthcare policies that mandate children, youth, and family-guided input, service integration and coordination, cultural and linguistic responsiveness to improve accessibility and availability of behavioral health care for the target population. Our second goal is to develop and implement community-wide social marketing, education, and messaging to reduce stigma about seeking and receiving mental health treatment and/or co-occurring substance use disorder. Our third goal is to increase the competency and capacity of local behavioral health, physical health, education, and social service providers to deliver programming that addresses the needs of the target population. Our fourth goal is to increase children, youth, and family representation and input on the design, development, and implementation of services that target them. So that's where that advocacy piece comes in. We really want to hear from the youth and the families so that we know how to provide services better to them and make them more accessible. So through the partnerships, SOC will leverage our school-based pediatric healthcare network to expand access by linking the target population to board-certified child and adolescent psychiatrists, advocate for increased funding to cover healthcare costs, including diagnostic and evaluation services of children and youth who are ineligible for Medicaid and private insurance, and deliver training and technical assistance to primary care physicians, including pediatricians, to raise their awareness of the necessity to assess substance use history, trauma history, risk for suicide, and general health conditions as part of the routine care of children and youth, and by extension, their adult family members. So the proposed system of care will establish a mental health access and primary care practice program. It provides training and technical assistance to local pediatricians and primary care physicians on how to incorporate behavioral health assessments as part of a routine care and refer patients in need to SOC clinical partners. In consultation with the SOC core team, we will also explore promoting the adoption of standardized behavioral health screening tools that the providers can use while child's visits. And countywide adoption of a single tool or set of tools would facilitate population health management of the target population and improve the quality of data available on the incidence and prevalence of various conditions and their treatment outcomes. So incorporating this into regular well-child visits also helps us to reduce the stigma of mental illness because it just becomes a regular practice when when the child goes to see their doctor. And then our fifth goal for the SOC is to increase partnering behavioral health providers' capacity to serve children ages 0 to 6 who are at risk for or who have serious emotional disturbance and their families through the implementation of an early childhood evidence-based practice. So now switching over to the Healthy Transitions Grant, our 16 to 25-year-olds. The Healthy Transitions Award will provide important resources to expand access to developmentally, culturally, and linguistically appropriate services and supports for at least 275 transition-aged youth and young adults ages 16 to 25 who have or are at risk for developing severe mental health conditions. In Prince George's County, over the course of the next 5 years, we'll also be focusing on the youth who meet this criteria and are also aging out of foster care or coming out of the juvenile justice system. So our partners, some of them are the same ones as the SOC grant. University of Maryland, Baltimore is our evaluation team again to collect and report on data. Maryland Family Resource Center and iMind are our outpatient mental health clinics. Maryland Family Resource is able to work with individuals under the age of 18, and iMind works with adults. So again, this helps us bridge that gap between pediatric healthcare and adult. And then the Maryland Coalition of Families, they'll have a youth coordinator. They will also have youth leadership and educational enrichment activities, and they'll be co-chairing the establishment of a Prince George's County Taking Flight program, which will train youth aged 18 to 26 to use personal experience with behavioral health challenges and trauma to advocate for positive system changes and support the development of a young adult peer network in Maryland. And then for this particular project, the Healthy Transitions, we do have a project director who will be starting next week. So we're very excited about that. And she will be overseeing the whole project and leading it. So our first goal is to expand and increase access to transition age youth treatment, recovery, and support services, including strengthening evidence-based practices that will address all life domains for the population of focus. Our second goal is to increase the self-efficacy and meaningful participation in transition plans of transition-aged youth who have mental health and/or co-occurring substance use disorders. Our third goal is to increase community buy-in and responsiveness to transition-aged youth service needs and outcomes. And then our fourth goal is to develop and implement a county-wide social marketing and education messaging to reduce stigma about getting help for mental health and/or co-occurring substance use disorder. So we really want to hear from the youth with this project. We want to empower them to speak up about what it is that they need. We want their voices heard. We want them to be at the forefront of this. And then these are just some of the points of contact. My information is there as well. If any of you have any questions or concerns that you think of or comments that you think of, later on, you can always reach out to me. Another thing that I do want to add is that implementation for both of these programs, SOC and Healthy Transition, will be taking place March 30th. So March 30th, we will be all set to receive referrals for anyone who fits into any of the criteria that I discussed here. The referral form will be available on the health department's website under behavioral health services, and the Step Forward tab will have the link as well as a QR code. And we will also be placing the link and the QR code on our partners' websites as well. So the main referral sources will be Department of Social Services, Department of Juvenile Services, and the public schools in Prince George's County, but anyone can refer someone. It could be a self-referral. If you know someone who could benefit from either of these programs, you can also just click onto that link or scan that QR code and fill out the referral and get them connected. Any questions? All right, well, thank you so much.
Hello.
Oh, yes.
Hello, everybody. This is wonderful. When answering the question about advice, I had symptoms of anxiety even as a child. And when taken and tested for brain tumors or some other kind of disorder, and the test results always coming back negative, it was impressed upon me that these symptoms that I had were manifested only in my imagination. It is wonderful to know that we now have programs, this program, that will understand and will speak to those types of conditions that children are actually experiencing and will better understand and attend them. This is wonderful. Thank you.
Thank you. Yeah, and definitely partnering with physicians to make sure that assessments are part of well child visits will help that also, because they could be looking at, well, maybe it's not something necessarily medical that you could pick up in a brain scan, but it might be something, you know, behavioral health related that's happening.
I just have one question. I'm sorry.
Oh no, I just saw, I don't want to say her name wrong, Miss Tazanu.
Uh-huh,
I saw
correct.
your hand up for a while.
Okay, that's okay. So I had a question about the referrals. When the referrals are completed, is it a paper referral? Does the information go into a database so that you can track information about what types of referrals are coming in? I just wanted to understand that for families that we may be referring in from different sources.
Yeah, so the referral is all electronic. Once you
Okay.
hit submit on that, it does go into a database and we will be able to receive the referral
Good.
so that we could push it to whichever provider under the grant will be best to address
Sorry.
that individual's needs.
Okay, thank you.
You're welcome. Yes, Miss Fowler, you were asking
Yeah,
something?
I was just
Yeah.
gonna ask, it seems like, is there, I see there was a finite number of potential referrals being accepted into the program. Is there going to be a wait list or is there flexibility in expanding that? I just, knowing the kind of services that, I mean, this is wonderful. I'm afraid you're going to be overwhelmed and inundated. So just didn't know what the thoughts were on that.
Yeah, so the goals that we have, we were able to take more than that. We do have it split up over the years, like having 50 in one year or anticipating 75 in another year. So we anticipate that we will probably have more referrals than that. So we did partner with providers who have the staff and who are able to serve these populations adequately.
Thank you.
You're welcome. All right, well, thank you all.
Thank you so much for that, Brittany.
You're welcome.
I will be sure to send out these meeting slides so everyone will have access to the content here. And then also we will share Brittany's contact information and also these additional points of contact.
Thank you.
Thank you.
Thank you
All
so
right.
much.
And moving into our next presentation, so one of the BHAGs, one of our central goals to the work that we do in addressing youth mental health has been the partnership with the Maryland Consortium on Coordinated Community Supports. And as I'm looking out in our audience today, I'm seeing Gap Busters and Spectrum of Hope here today represented as grantees of the consortium. So it's wonderful to have you all here. The BHAG, one of the main goals is trying to create a process and create awareness in one shared space. We certainly want this spokes model to come together. And we hope that this meeting space can be a monthly space in which organizations can connect. We can help problem solve and overall raise awareness of resources across Prince George's County. So today's presentation is an effort to do just that. So we are joined today by Dr. Tazanu from Spectrum of Hope. She really needs no introduction for all of the amazing work that her and her team are doing. But Dr. Tazanu is a pediatrician with greater than 20 years of health and community service provision. She is a mother of 5 inspiring adult children, 3 of whom have autism and related coexisting emotional concerns. She serves as Spectrum's lead medical guide and consultant, where she pursues her passion for enhancing the lives of those living with ASD and related different abilities while enriching the communities in which we live. So thank you, Dr. Tazanu, for joining us today. I will go ahead and stop sharing my screen so you can share your slides.
Okay. Well, thank you for having me. This was quite a surprise to be able to kind of present at this level. So, and I'm really very happy and thrilled about the integration of the grantees and what's happening on the community front in the county. So let me pull up. I have it's an 8 slide presentation, so it's not very long and really open to questions. So as we shared before, I am a general pediatrician. I'm not a behavioral health provider, but because of my experience in terms of just supporting my children and their needs, I have really not practiced general peds for more than half the time I've been in medicine. And my focus has been primarily supporting children with developmental differences, primarily autism. And along with autism, we almost always see behavioral health challenges that are co-occurring. Our practice, I'll go a little bit into our practice. Our practice is Spectrum of Hope, but the program that was funded under the CHRC grant is called Hope Connections. And that program was really born out of the experiences that we as parents, not only parents, but professionals have faced when it comes to supporting our children with their unique developmental and behavioral health differences. So Hope Connections is really at the core of it, a family guidance and navigation program, but we really are a group or a collective of various entities that have come together to provide this guidance. And our goal is really not to just provide a referral and tell a family, well, be on your merry way. But our goal is really to be able to link them to services and supports that are integrated into our guidance program so that parents are receiving what I term as a hot referral. So something that they get, and we know for sure that because these people are our partners and we have agreements in place and we all are aligned, that that family is going to get that service. And so that really is our goal. We want to be able to change the narrative of what it means to live with autism and related neurodiversity. We want to be able to create resilience for our families. Oftentimes when people hear of autism, hope is the first thing that goes out of the window. And oftentimes there's a very negative and doom and gloom picture that comes to most people's mind. And also for those of us that are living with it. So we want to be able to change that narrative. And we know that we can do that when we're building partnerships. In terms of who we want to support, all children, but we really have a special interest in children that are marginalized. And when we say marginalized, we're really speaking to children of color, lower socioeconomic status, because we know that these children are typically children that are either not identified early, they may be misidentified, and so there are huge ramifications for that occurring. So in terms of who we are a social purpose entity, even though we are not a nonprofit, we are a medical practice, but we really consider ourselves a social purpose entity. And collaboration is what we do. We serve from our hearts. And we also really are very mindful of how culture plays into our services. Our purpose is really to help those living with neurodiversity and co-occurrent behavioral health. We really want to see them secure opportunities and experiences that build hope, health, and happiness. And that's how we really define well-being. And why is this important? It's really important because emotional and neurodiverse conditions directly impact behavior of children and youth. And often behavior is the first sign of these challenges. But way too often, our children, when they are kind of experiencing maladaptive behaviors, they're not understood. And instead of getting evaluated, their behaviors are usually addressed with punitive measures. And those measures can really have lifelong outcomes that are poor and really lead to increased levels of stress and dysfunction for families. So family is really the foundation for every child. And we want to make sure that they are supported, that they are educated. So they really are in a place that they can advocate not only for their child's needs, but also for the needs of their family. In terms of who serves, so we have a variety of individuals that will be serving under this grant. The majority of us are parents, or many of us have a life experience or connected to those very closely that are living with neurodiversity. We're also professionals, and we are really happy to have an array of a variety of different disciplines that are working with us. So those that are in medicine, we will have a child psychiatrist that will be working with us, but we also have parent professionals who are in the field of education, in the field of family support, advocacy, and behavioral health. So it's really important for us that parents can see themselves in the providers as well, and we can see our journeys in those that we serve. It really allows for a big connection, a huge connection. So that's really where that lived experience comes in. How we really want to show up and how we want to impact include identifying our children and youth. So that really is important, and we have to do a lot of outreach to do that. And in order to do that, we've established a long partnership with the health department. Rhonda Mitchell, who introduced herself earlier, is our outreach coordinator. And we've actually worked in the county through another entity called One World Center for Autism. We did a lot of physician outreach. So when I heard information on the grant about primary care integration of behavioral health, that's right up our alley. We'd love to be able to partner and help with that, because we had outreach to almost 200 pediatricians in the county. And a lot of this was actually introduced at that time. But also linkages to support. And again, I will reiterate this, that hope, health, and happiness, that's how we measure well-being. So I want to just kind of give you an overview of the framework of our grant. And this is the thing that aligns all of us who are either staff, part of our team, those that are our partners in service. At the end, we want to see families become this, holistic family advocates. And so it was really important for our team to define what is a holistic family advocate. And again, this is informed by our journeys and from the journeys of those that we serve. The first is that we want to see parents, families, children, and youth experiencing greater and more consistent emotional and physical well-being. That seems like something that is so nominal, but it is a huge challenge sometimes in our community. Secondly, we want to make sure that families are successful when they try to access and navigate educational circles, vocational circles, but they're just experiencing success in that. When we look at many of our parents, when they really identify their two greatest sources of stress when it comes to supporting children with autism and related neurodiversity and co-occurring behavioral health, the first is always behaviors. The second really is that navigation of school systems to put the correct supports in place for their children. And we feel that if 1 and 2 are met, then families are able to self-actualize. They're able to show up in this world in the way that they want and desire to. So if they want to be politically involved in their community at a local level, at a recreational level, they are in that headspace that they're able to do that. What's also really important is that we encourage our families to also raise their voice in advocacy. And one of the most powerful ways that they can do that is to be involved in research. And we are very mindful of the fact that in terms of research for especially people of color, there's been things that have been not so ethical, and we really want to change that narrative by encouraging more researchers of color to be able to advocate for our voices. So we have a connection with Bowie State, a psychologist who really is interested, and her colleagues, in raising the voice of our families. So, and we really do feel that parents need to advocate for research to be reciprocal. So not just people swooping in, getting information and moving on, but that you're actually telling our stories and providing services that are meaningful for us. So this is our outcome. And so I'm going to give you a warning. Each slide is going to get a little bit more busy as we go. So this is our framework. Again, this was, let me see if I can get this to center. Okay. This is completely based on, like I said, experiences, our own personally and those of those that we serve. If holistic family advocacy is at the top of our staircase, then these are the steps that we feel are very important in order to reach the top of that staircase. We first have to identify our children, and identification is challenging. It's challenging for children with just straight behavioral health, but wait lists and wait times for children who are suspected of having autism wait list can be anywhere from about 18 months, some places as high as 3 years to get an autism diagnosis. And that's valuable time in that child's life. And it's also important that when children get these evaluations, that it's done in a multidisciplinary fashion. And so that you have additional providers, not only just looking at whether or not autism exists, but what are the behavioral concerns? What are the developmental concerns? So that the family has a real holistic picture of their child. Um, Typically, what happens now is that we go from step 1 to step 4, where we get a diagnosis and then we start to kind of tell parents about all the supports and services that are there. And we're lucky that we do have quite a bit of supports and services. Still need to build them. Years ago, it wasn't this way. But in terms of our years of practice, what we found is that when we jump from 1 to 4, we either have parents that are overwhelmed by the diagnosis and they're stagnant, they don't move the needle forward for their children, or they are attempting to acquire every support and service that they have been told about. And then we get the other end where parents are overwhelmed and very much burned out. So we wanted to be able to give parents a framework from which to operate. Hence, really spending time at step 2, which is acceptance. And any, diagnosis that has a lifelong impact, like autism, will cause emotional changes and sometimes turmoil and chaos. I know I experienced that myself personally with the diagnosis of all of my children. And so it's really important to have others who have walked that walk that can be there to help a parent get to a place of acceptance. And acceptance is lifelong, but you're in a space where you can now move to step 3, which we feel is the piece that's so missing for our children. And this is creating vision. What does my life and what does my child's life look like now that we have this diagnosis? Hope can be restored when we create vision. And then our goal is that by creating vision, now parents can be much more strategic, much more focused about the supports and services that they actually go after, instead of kind of grabbing for everything or not being able to grab anything at all. So this is kind of our framework, and we do our very best to introduce everyone to this framework. As you can see, there is a Maslow's hierarchy at the side, because we always have to consider that when we are supporting families. Sometimes autism is what brings them through the door, but that's not the biggest burning fire, so we must be mindful of that. In terms of the grant really allows us to do quite a bit of work. And I'm not going to go through this next slide, but this next slide is really an overview of all of the services that we will be providing in terms of the grant. We've divided each step and we've put in tiers of support under each step. And so it allows us to hire family navigators, peer support specialists, and coordinators at each one of these step levels in order to get our families to kind of go on their own personal journeys and to document that to holistic family advocacy. So we're really excited, very excited to learn about the other grantees, very excited about this whole Systems of Care grant, and how we can also play a part in terms of supporting our children and youth. Rhonda and I also serve on the local care team, so I chair the local care team, and Rhonda also serves in terms of taking minutes and interviewing our families. So we know firsthand that the need in our county is great. And so I'm just excited about this forum. This is my first time even learning about this forum. And I will encourage more and more people to be a part of it, because we really do need to know and learn about what's out there so that we can really support our families better. So thank you. Thank you for the opportunity to share. And if there are any questions, I'm happy to answer.
Hi, this is Kelly with Clarence, the QIO for Maryland. I didn't have any questions, but I wanted to share something with you that my neighbor brought me back from Brazil. It's a grocery bag that you can purchase. Can you see that?
Oh, yeah. Yes.
They don't allow
Awesome.
plastic, so you have to buy bags, of course.
Oh, wow. That's
they use, I don't know if you can see the artist signature on there. They promote local artists, and then they allow them to create the bags, and they sell them at the grocery stores, and the artists receive a portion of it. But autism is one of the areas that they do a lot of education for in Brazil. So I just wanted to share that. It's
Wow.
not just us.
Thank
Nice,
you.
nice, nice.
And the bag is adorable, right?
Yeah.
Right. Right.
Bill, this is Larry out from Shepherd
Hey,
County.
Larry.
Congratulations on your grant. I mean, I don't know if people know that, your focus was so needed in the county and that youth of color who are neurodiverse are the most under-identified and underserved group of kids. So, I mean, you just hit it, hit the nail right on the head in creating this program. The question I have is, and it's just wonderful what you've done in doing this, and it's, you really hit on the need. But when, there's so many mental health professionals, and I know we found this at Shepherd Pratt when we studied the
Mhm.
issue, aren't really well trained to treat kids with autism. And I was just wondering, are you going to do any training or like
Yes,
echo
yes,
supervision model or something to help,
yes.
make those referrals to people? You know what I'm saying?
Mhm.
Yes, exactly. And so, I wasn't sure how much time, but in the last slide I showed where there were tiers of support, under our tier 1 services, they primarily comprise of education and education for professionals. So we will have professional development for teachers, for physicians, and we will also do some for mental health providers as well. Anyone that is open to having autism training, we will do that. We did that many years ago and for many years when we were operating under the nonprofit in partnership with the health department. So it's just something that we're excited to be able to pick up again.
Because I know a lot of the providers, for instance, the school-based mental health providers would love that training in autism because regrettably, many of us in our graduate education didn't get any training in
Mhm.
identifying kids with autism or helping them. So that's just wonderful. Now I'll share that now with our Shepherd Flag.
Yeah, and anyone that is in need, I mean, even those that are on the call, if you desire an Autism 101, we're more than happy to do that. We've done it also for childcare providers. So, anyone that touches a child really needs to have at least an awareness and to make that referral, because that can be truly life-changing for not only the child, but for the family as well. Thank you. Thank you, Taylor, for inviting
Thank
us and
you.
allowing us to share.
And I think we had a question here in the chat a few minutes ago asking, do you serve children who have care for kids?
I'm not sure what Care for Kids is.
I'm not sure.
So I will
Yes,
clarify. This grant, the age range for this grant is 3 through 13. And we do have 3 target schools that the county identified, but we will be taking children across the district. Children that are either younger or older than that age range, we will serve them as well. We do take some Medicaid insurances and some private insurances, but we'll do our best to really serve all families. I'm not sure what Care for Kids is, though, and if it's an insurance. It doesn't sound like a insurance program. I know there's MCHIP, the Maryland Children's Health Insurance Plan, but I'm not sure what.
Not sure if we still have a person on the phone, but thank you so much, Dr. Tasnu, for that presentation. Thank you for sharing that. As I mentioned before, the BHAG, we hope to be a synergistic body to bring together all of these resources and raise awareness. So if we have any other grantees who wish to share in future meetings, please do let us know. And Dr. Tasnu, certainly with Spectrum of Hope, please do let us know your progress in upcoming months and throughout the grant period, and do let us know how the BHAG can support you.
All right, will do. Thank you.
And Miss Cheryl, I see your hand raised.
Yeah, this was so doggone important, and my connection went blank. Doctor, I had to work my way back in because at the Black Mental Health Alliance, we maintain a database all right? And I need to put the information that you presented about you guys and where you are in that database, if that is agreeable with you. We get calls, we get
Of course.
in-person requests, we get emails with those persons wanting information and a connection around this. So could you please put your location, contact information in the chat, and
Sure.
I'm going to add that to our database. Thank you so much.
Will do, will do.
Great. Well, thank you again very much for that presentation. And I am going to shift us over to our next activity to end us out for the afternoon. So this afternoon, we have done a lot of talking at you, but we hope that we can now hear from you specifically through this questionnaire. So I am going to put some directions here in the chat. If everyone could go to www.menti, that is MENTI.com, and enter this code. It is 25658786. And hopefully you should be able to see the screen that I am currently sharing. And if you are on a cell phone, you can take a picture of this QR code and it will also take you to the questionnaire on your phone. Everyone been able to reach the questionnaire okay?
Mm-hmm.
Anyone experiencing any challenges? All right, great. So we just want to hear from everyone on the call today a little bit more about your interactions with youth as it relates to youth mental health. And again, in trying to bring the BHAG together and raise awareness for all of the valuable resources that are offered for Prince Georgians. We hope that we can collect a little bit more information about you all and be able to figure out how we can build this continuum of care that exists outside of crisis and be able to raise awareness of all of the wonderful opportunities and resources in Prince George's County. So our first question here asks, what types of interactions do you have with youth in your job or life? And if you were at our quarterly meeting, this looks familiar, but our options are direct, indirect, both, or not applicable. So we're seeing majority of folks have both direct and indirect interactions. Would anyone like to share a little bit more specifically about their direct and indirect, if they fall in any of these specific examples?
Yeah, hello, this is Kent. I'm a member of the 100 Black Men of Prince George's County. That organization proper is designated to support mentoring young people. Our children are I think as early as 7, and we go to 21, 22, 23. So, and most of the children are obviously falling, young people falling in between 10 and 15. So that's a huge direct impact we have. And these are kids that we mentor to success, whether it's professional, we use IT, science, business, we give them all the things that we have as professional men to support them in their growth.
Thank you for that, Kent. And please do let us know how we can support you in that.
Thank you.
I had a quick question, Mr. Kent. What is the age range for that?
They go as early as 7,
Mhm.
young as 7, and we take it up to 22.
Okay.
And we have what we call a Saturday Leadership Academy. So this is shared by both the parent and the child. So both people come, or just the child, but usually the parent is somewhere in the room, and it's amazing. It's on our website, the Saturday Leadership Academy.
Thank you.
And I see Miss Rhonda, you have your hand raised.
Yes, I just wanted to ask the gentleman that was just talking about the academy, and you said the name of it is called Proper.
No, it's the 100 Black Men of Prince George's County.
Oh, I thought I heard you say something about Proper.
Well, I said proper in that that's the designate. There's the 100 Black Men of America, but we're the 100 Black Men of Prince George's. So we're a subdivision of the main organization, which is important because Prince George's County is rich of resources. So we want to be able to, support that county effort, though we do have kids coming from other counties, so they hear about us. We don't say no, but we are really focused in on Prince George's County.
Oh, okay. Thank you.
Mm-hmm.
Thank you for that. And if you have any links or any events that you would ever like us to include in the newsletter, so you certainly email those my way, and I will make sure those get to the proper channels.
Yeah.
All right, we will move to our next question. So this question asks, what age groups does your organization serve? And for this question, you can select all that apply. Seeing some more responses come across. Does anyone have any reflections on this question or have any services they want to highlight? Ms. Cheryl, I see your hand.
She's muted.
Oh, Ms. Cheryl, I'm sorry. I think you're muted.
I needed to select more than one age group, but it only would let me do one. Did I do something wrong?
Oh, it might be the settings, but I can go back and change it. But what options did you want to pick?
18, actually 18 through 26, those two groups.
All right. Thank you all for your responses. We'll jump into this next question. For this next question, hopefully you should be allowed to submit as many responses. These are going to be open responses, and what I'll do after we get all the open responses is I can group them by Northeast, Northwest, and we can be able to see those broken down categories, and I'll send those out with the meeting notes. I see one response here, targeted schools in the Landover area, the entire county. Are there any other specific middle or high schools that folks are focusing services? Okay. So seeing majority the entire county, mainly in Hyattsville, Riverdale. All right, and I'll ask, do folks feel that there are gaps in location where services are offered in Prince George's County?
Did you want us to enter that or just answer the question?
Oh, no, we can just have open discussion. If that's okay.
Okay. Well, I would say that, where there are large immigrant populations, I feel like there are gaps. Sometimes it's a language barrier. There are a lot of cultural nuances to reaching out, and sometimes it may also be challenges or barriers with entities being able to have translation services and hire staff that can be culturally sensitive. So it makes certain areas those demographics a little bit harder to reach and support holistically.
For that, Dr. Tasneem. I'm sorry, Ms. Cheryl, were you saying something?
Let me put my hand down. Yeah, I find that there are deserts. When you look at Seat Pleasant and you look at those communities right by the border with the District of Columbia, and then also when you're going over on the other side, the Tacoma Park area, and I believe we're talking about those areas where we're having, I don't want to say just Hispanic, because we've got a number of cultures of people living there in the Tacoma Park area. So when you're looking at the dividing lines, I should say, for Prince George's County, Montgomery County, for some reason there seems to be swells of resources in areas, but they are logistically kind of far away from those communities by the lines of demarcation.
Yeah, I would definitely agree.
Mm-hmm.
Thank you for that. And I will group all of these responses together and again send those out with the meeting notes. Our next question here, what services does your organization provide? And again, this is a select all that apply. And if we understand that this list is certainly not all encompassing. So if anyone else has anything else to add, please feel free to come off of mute and let us know.
Oh, don't put it next to the stove. But leave it.
So seeing a divide across substance use, mental health services, and peer recovery support services. Are there any services that you all provide that is not listed here?
Oh.
All right, and now we're seeing some responses across the board. So again, this is very much reflective of the BHAG and all of the expertise you all bring to the group and how much we can all learn from one another. So really glad to see the variety and representation across all of these different service areas. And lastly, we have a word cloud here. So if you could describe gaps in youth mental health, and this is specifically in Prince George's County. And for these responses, I believe you are allowed up to 25 characters. So if you have anything that you want to add, feel free to unmute and we can have a discussion. So with these two responses, so there are gaps in support, gaps in communication. Would anyone like to elaborate on these gaps?
This is Nesreen Hill from Gapbuster. I will say in the past, working with PG County, that we have experienced gaps in, I guess, the communication with the youth about the mental health supports that are out there and what they can do to access them, and how, and openly speaking about them, like, telling their friends about them, because it's like something that they're like ashamed of almost. So that open support and communication.
For that. So the need for greater awareness, greater need for communication. I'm hearing there may be forces of stigma there, especially amongst youth. We had assessment, gaps in assessment. And Ms. Cheryl?
Transitional housing for young adults and youth.
That's a big one. Yeah, it's a big one.
All right, we have insurance reimbursement, educational supports, reducing stigma, culturally sensitive care, cross-discipline collaboration, transitional housing.
Crisis response is good.
Thank you, everyone.
Can I also add, I think, and I think this is not just only for Prince George's County, but maybe statewide as well, just hospitalization, emergency hospitalization for children and youth, also residential placements for children and youth experiencing, intensive behavioral health, partial hospitalization programs. Like, we don't have any of these things in the county. All of our children have to go out of county to get these services. So those are huge gaps.
All right, any other comments or reactions? All right, well, thank you folks for participating in these questions. Again, I will put out this word cloud so we can continue to reflect as we move forward in our monthly convenings and see, how can we address these things? What resources can we uplift? And how can we continue as a BHAG to advocate for these resources for youth and young adults in Prince George's County? So to wrap us up, we are just going to move into some community announcements. So first, we have upcoming the greatest of all time. The Youth Mental Health Expo is being held at Bowie State University on Saturday, May 18th at 8:30 a.m. This is an all-day event, and I can put the link to register in the chat. We also have the NAMI walks on Saturday, May 4th at Elizabeth Seton High School in Bladensburg. Last month, you may recall our presentation from Miss J.B. Moore. So really happy to be able to put this out as an upcoming event. And do you folks on the call, do we have any community announcements? Any programs going on that anyone would like to share?
I'll share the Prince George's County Public Schools will have a parent empowerment conference. And that is a virtual conference. So the dates are still being confirmed, but anyone can reach out to the Prince George's County Family Support Center for that. And then they will also have their second annual Autism Summit, which will occur on April the 20th. And that is an in-person conference. So if anyone has family members or educators, anyone that'd like to be a part of that, they're more than welcome.
Very much. I will be sure to include those events in our meeting notes. And thank you, Kim, for dropping that in the chat. Any other community events or any other announcements?
Hello, this is Brittany, the program assistant for Gapbuster Inc. Thank you guys for having us to join this. We learned so much from you guys' presentation. I just wanted to inform you guys that we have moved to a new location. We're in Rockville, and we are having an open house on April 24th. And if you can come out, we'll send you guys the invitation so you guys can come see our new facility, and then you can talk with myself, Nezrine, and Dr. Butler to know what programs we offer, how we are a big contribution to the Prince George's County community.
What'd you say the name of the open house is?
The open house is on April 24th at 5 o'clock.
But what's the name?
Oh, Gapbuster Inc. And
GAP?
GAP, B as in boy, USTER.
Okay.
Thank you so much, Brittany. And if you all would ever like to present in one of our monthly meetings, do let me know, and we would be happy to reserve you some agenda space. All right. Well, thank you all so very much for holding on until the very end. We really appreciate your attention today and all of your participation. So we will meet. Our next meeting is going to be on Wednesday, April 17th at our usual time from 3 to 4:15 p.m. Here on Teams. If you need future invites, please do let me know, and I am happy to forward those meeting cadence to you and any of your staff.
Thank you.
Thank you, Taylor.
Thank you so much.
Thank you so much. Have a great day.
Yes,
Thank you
everybody
as well.
stay
Happy
safe.
spring, everyone.
Thank you.
All right. Bye.